Anxiety and addiction often go hand in hand, creating a vicious cycle that's hard to break. Whether it's turning to substances to calm anxious feelings or developing anxiety as a result of addictive behaviors, the interplay between these two conditions can be complex and overwhelming. In this video, we'll explore why this happens, the science behind it, and practical steps you can take to manage both anxiety and addiction effectively. The link between anxiety and addiction. Anxiety disorders are one of the most common mental health issues, affecting millions of people worldwide. On the other hand, addiction is a chronic disease that affects the brain and behavior. But how are they connected? 1. Self-medication hypothesis. Many individuals with anxiety turn to substances like alcohol, drugs, or even certain behaviors like gambling to self-medicate. This temporary relief can quickly lead to dependency as the body starts to crave the substance or behavior that provides relief from anxiety. 2. Biological factors. Both anxiety and addiction involve changes in brain chemistry. Anxiety disorders often involve an imbalance of neurotransmitters like serotonin and dopamine. Similarly, addictive substances and behaviors can alter the brain's reward system, leading to cravings and dependency. 3. Genetic predisposition. Studies suggest that genetics play a role in both anxiety and addiction. If you have a family history of either condition, you may be more susceptible to developing both. 4. Environmental triggers. Stressful environments, trauma, and chronic stress can trigger both anxiety and addiction. These external factors can create a breeding ground for both conditions to develop and thrive. The vicious cycle. Once addiction sets in, it can exacerbate anxiety symptoms, creating a vicious cycle. Here's how. 1. Increased anxiety. Substance abuse can lead to increased anxiety levels, especially when the effects of the substance wear off. This withdrawal anxiety can be severe and can drive further substance use to alleviate it. 2. Health consequences. Long-term addiction can lead to physical health problems, which can increase anxiety. For example, alcohol abuse can cause liver disease, which in turn can lead to increased anxiety about health and well-being. 3. Social and legal problems. Addiction often leads to problems at work, in relationships, and with the law. These issues can increase stress and anxiety, further fueling the cycle of addiction. 4. Impact on mental health. Addiction can worsen mental health conditions, including anxiety. The emotional toll of addiction, coupled with the stigma and guilt often associated with it, can heighten anxiety levels. Breaking the cycle. Breaking the cycle of anxiety and addiction requires a comprehensive approach. Here are some strategies that can help. 1. Seek professional help. Therapists and counselors trained in both addiction and anxiety can provide the support you need. Cognitive behavioral therapy, CBT, is particularly effective in treating both conditions. 2. Medication. In some cases, medication may be necessary to manage anxiety and support recovery from addiction. Always consult with a healthcare professional to determine the best course of action. 3. Support groups. Joining support groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, can provide a sense of community and shared experience. These groups often offer specific support for those dealing with both anxiety and addiction. 4. Mindfulness and relaxation techniques. Practices like meditation, yoga, and deep breathing exercises can help manage anxiety symptoms and reduce the reliance on addictive substances or behaviors. 5. Healthy lifestyle changes. Regular exercise, a balanced diet, and adequate sleep can significantly improve your mental health. Reducing caffeine and sugar intake can also help manage anxiety symptoms. 6. Therapeutic interventions. Therapies such as dialectical behavior therapy, DBT, and eye movement desensitization and reprocessing, EMDR, can be effective for those dealing with trauma-related anxiety and addiction. Practical tips and daily habits. Implementing small daily habits can make a big difference in managing anxiety and addiction. 1. Stay connected. Maintain regular contact with friends and family. Isolation can increase anxiety and the temptation to use substances. 2. Set realistic goals. Break down your recovery journey into small, manageable steps. Celebrate each milestone to stay motivated. 3. Keep a journal. Writing down your thoughts and feelings can help you identify triggers for both anxiety and addiction. This awareness is the first step toward managing them. 4. Develop a routine. Structure your day to include time for self-care, work, and relaxation. A consistent routine can provide stability and reduce anxiety. 5. Limit exposure to triggers. Identify and minimize exposure to people, places, and situations that trigger anxiety and cravings. 6. Engage in healthy hobbies. Find activities that you enjoy and that can distract you from anxiety and cravings. This could be anything from reading, painting, gardening, to playing a musical instrument. 7. Practice self-compassion. Be kind to yourself and acknowledge your progress, no matter how small. Recovery is a journey with ups and downs, and self-compassion can help you stay resilient. Inspirational stories. Hearing about others who have successfully managed both anxiety and addiction can be incredibly motivating. Here are a couple of brief stories. 1. John's story. John struggled with anxiety from a young age. In college, he turned to alcohol to cope. After years of battling addiction, he sought help from a therapist who specialized in both conditions. Through therapy and support groups, John learned healthy coping mechanisms and has been sober for 5 years. 2. Lisa's journey. Lisa's anxiety led her to develop a prescription drug addiction. With the help of a supportive network and a comprehensive treatment plan, Lisa managed to overcome her addiction and now uses mindfulness and exercise to keep her anxiety in check. 3. Mike's experience. Mike's social anxiety drove him to seek solace in drugs. After hitting rock bottom, he joined a rehab program that addressed both his anxiety and addiction. Today, Mike is drug-free and works as a peer counselor, helping others facing similar challenges. 4. Sophia's recovery. Sophia's addiction to painkillers started after a severe injury. Her growing anxiety made her dependency worse. With the help of a holistic treatment program that included therapy, medication, and lifestyle changes, Sophia has been in recovery for 3 years and now advocates for mental health awareness. Understanding the science. Understanding the science behind anxiety and addiction can provide insight into why these conditions are so closely linked. 1. Brain chemistry. Both anxiety and addiction involve neurotransmitters like dopamine and serotonin. Anxiety often stems from imbalances in these chemicals, while addiction alters their normal functioning. This creates a feedback loop where anxiety can lead to substance use, and substance use can further disrupt neurotransmitter levels. 2. Stress response. Chronic stress is a significant factor in both anxiety and addiction. The body's stress response, which includes the release of hormones like cortisol, can be heightened in individuals with anxiety. Addictive substances can initially dampen this response, providing temporary relief, but over time, they can exacerbate stress and anxiety. 3. Reward system. The brain's reward system, which is activated by pleasurable activities, is hijacked by addictive substances. This system is also involved in anxiety, where it can be overly sensitive to potential threats. The interplay between seeking reward to alleviate anxiety and experiencing increased anxiety due to addiction creates a complex dynamic. 4. Neuroplasticity. The brain's ability to change and adapt, known as neuroplasticity, plays a role in both conditions. Addiction can rewire the brain to prioritize substance use, while anxiety can change neural pathways to make certain fears more persistent. Understanding these changes can help in developing targeted treatments. The role of trauma. Trauma is often a common thread linking anxiety and addiction. 1. Childhood trauma. Early life experiences, such as abuse, neglect, or witnessing violence, can lead to long-term anxiety and increase the risk of developing addiction later in life. These traumatic experiences can disrupt normal development and create lasting changes in the brain. 2. PTSD and addiction. Post-traumatic stress disorder, PTSD, is a condition that often co-occurs with addiction. Individuals with PTSD may use substances to numb their memories and emotions, leading to dependency. The intrusive thoughts and hyperarousal associated with PTSD can also heighten anxiety. 3. Healing from trauma. Addressing trauma is crucial in treating both anxiety and addiction. Therapies like EMDR, trauma-focused CBT, and mindfulness-based stress reduction can help individuals process and heal from their traumatic experiences, reducing their impact on mental health. Understanding the connection between anxiety and addiction is the first step toward breaking free from their grip. Remember, you are not alone, and help is available. By seeking professional support, making healthy lifestyle changes, and staying connected with supportive people, you can manage both conditions and lead a fulfilling life. If you found this video helpful, please like, share, and subscribe. Let us know in the comments about your experiences with anxiety and addiction, and what strategies have worked for you.